What's up, guys? Long time no see. So, interesting vlog here today. Someone in our immediate family tested positive for COVID-19 that we were in contact with a few times last week. So, we're advised to get tested, self-isolate, and all those things. The problem is getting tested is still a cluster, you know what. So, first, we tried to do it today. If you go on Google, it'll give you like a search results for places that are doing it. Some CVS's are doing it, but their website doesn't really work. It shows there's available dates, but then you put in all this information. Ashley went through name, email, pictures of her insurance card, all this like nonsense to do it, and then it just like errors out, and you have to start all over again for each individual time. Start the whole thing all over again. So finally, we just called and thought maybe their website just is messed up. We'll just call and ask them if there's any dates. She said the website is messed up, and if it doesn't work, it's because those dates are filled and they're booked out like till at least the middle of till Saturday, I think. So I went in and tried to just pick a date Saturday. If you pick it, it doesn't show any dates at all, so that doesn't work either. I don't really know what to do there. So then any hospitals that are doing it around here either require a referral or I guess maybe if you're high risk or older or something like that, or they or by appointment only or whatever. So Ashley calls her doctor's office to try to get a referral so we can go get that. What did they tell you?
Well, I called them this morning when we first found out, and I just said, hey, this is what's going on. We were just around this person. Should we get tested, or, should we just self-quarantine? Like, what should we do? And they said, she told me, you should absolutely go get tested today, is what the girl told me. She talked to the doctor. That's what the doctor said. Self-isolate, obviously, and also you should go get tested today. I said, okay, great. Well, I called them back and I said, I called earlier. They said we needed to get tested, and we need a referral to make an appointment at a lot of places. And they were just like, yeah, a lot of places aren't really testing. I can give you the number to the Ohio Board of Health. Like, what is that gonna do? No, just give me a referral to go get tested. Like, I don't understand why I can't just get a referral to go get tested. It's crazy that my sister got one, but she's pregnant, so that kind of made sense. That she called her doctor's office this morning. They sent her to go get tested. She went and got tested, came back home, like, no problem. So I get it, she's pregnant, but I mean, I don't know. I just don't understand why we can't get a referral. Like, we've been in direct contact, not just like, oh, hi, like we've spent hours with this person in the last week on multiple occasions. So I don't understand, like, and we could have been the one to give this person COVID. We could have had it this whole time and not known it. And maybe we gave this person COVID, and then they just happen to find out that they are positive now.
Here's the other thing, too. Our county is one of the highest in Ohio. It's spiked like crazy here. Like, nobody wears masks. I mean, we have ours, but I was in Cleveland this past week for work. There, I would say probably about 8 out of 10 people are wearing masks. Here in Cincinnati, Hamilton County area, I would say it's maybe 1, possibly 2 to every 10.
Yeah. No one wears them.
No one wears them.
The only people wearing them are pretty much people who are being forced to wear them. Like, if you go into a store, all the employees have them, but all their noses are out. So what's it?
Or this.
Yeah.
Just because they legally have to, or whatever, for their job. So, I mean, it's
if that's the case, shame on management for not making their employees do what they need.
So it's spiking like crazy here.
Look at this kid walking out right here.
You can't get tested.
His mask is all the way down around his neck, and he's going out to someone's car with some items.
Yeah, I get it when it was March, maybe beginning of April, we are in the end of June now, and you still cannot just go get tested if you need to. I mean, I maybe understand if it's just like a nervous Nancy or whatever that hasn't been in contact with anybody, no contact tracing, nothing, and they just are like paranoid and want to go get tested. But like Ashley said, yeah, I mean, we're in a high outbreak area. We've been exposed now, and it is just not easy to go get tested. I mean, it's not. Websites aren't working. People are just passing you around a cycle of people to talk to everywhere. If there's tents where there's nobody in line, but you can't just drive up. You gotta have a referral from a doctor that won't give you one, I guess. Won't give you like an extra piece of paper or whatever. I don't know. It's a mess, and you really have to be like dedicated, I guess, and deliberate to get this, which is not a good way to solve this problem. Is if people need one and they want one, they need to be able to get one before they just give up and say, you know what, I'm not showing any symptoms. You're not showing any symptoms. What's to stop us to just be like, we tried, and just forget it. So, I don't know, it's frustrating. I guess we'll keep trying. It is Thursday. I likely won't go to work tomorrow. She's off on her 2-week break anyway, which is, I guess, nice. But I don't know. Maybe by some point this weekend or something, we'll be able to get a test. But for now, we go into self-isolation, and this, I don't know, will be an interesting vlog. Oh, you're about to shut that door and not come back out of it for 2 weeks.
I'm not gonna make it. Shouldn't it be?
I mean, we have to come out Saturday because we gotta go get tested.
Oh yeah.
Did I mention that we got tests scheduled for Saturday?
Yeah.
At the CVS.
Is that on me?
Yeah.
Is it like real close to
No,
me?
it's no. I mean, you probably won't like it. What's the music from Outbreak? I don't remember.
I don't know, but I'm gonna be spending a lot of time.
No, you can't be out in the air. The wind will grab it and spread it to everybody on the street.
Is that real?
I don't think so.
I'll wear a mask.
Okay.
Hello, Kevin. We'll get food. We're not gonna run out of food or anything, okay?
Yeah, because we're running out of food we like to eat.
I know you like to eat. We have food for today. We're gonna get groceries. It's not.
Give me those chips. Ow.
Did you notice how smart he was?
Yeah.
You were like, wait, he said, oh wait, he didn't just get it, so that means when we saw, and you were like, yep, like,
No, he put it down.
you put 2 and 2 together. He's so smart. You want to tell them about their, you know what?
No, we'll save that for another.
All right, so it is Saturday. Getting there. We are heading to get our coronavirus testing done.
Ryan's not happy.
Not happy. Trying to talk Ashley out of it. Well, here's the thing. So, our exposure would be a week this coming Sunday. We get tested today. Because of, I mentioned earlier, it's a hot spot right now. There's a lot of cases. They're backed up on test replies for probably 3 to 5 days. So maybe we get our results by Wednesday. By then, we're like a few days from our 2-week isolation period being over.
Yeah, but if it's positive and we have it, I feel like we have to take further measures.
Here's the other thing. Apparently at CVS, we're going to find out. You guys will find out with us.
Someone told us we have to do the test ourselves, which means we have to shove the thing up our nose ourselves. Which means I'm going to shove it up Ryan's nose, and he's probably going to have to shove it up my nose, because there's no way you can do that to yourself.
Or, like, why would they even trust that people doing it to themselves are going to shove it find out though. Maybe that's just a rumor. I don't know. But, oops. Pulled right out of the thing.
Yeah, hopefully it's not true, but we'll see.
I don't know. We're on our way though.
Yep.
Here, it looks like we were not wrong. I assume that we just go to the drive-thru. They'll probably pass through the kit to us. Then we swab our brains and give it back to them.
I want to do it myself.
Want me to do it? Only problem if I do it, if I start pushing, you're like, stop, stop, stop. I'm going to stop.
I'll try not to say stop.
Well, we all know you can't do that.
Ryan Campbell.
Do you need a safe word?
Oh my gosh.
Corona is the safe word. Oh. So while we're waiting, everybody out there, just wear a mask. Just when you go out, wear a mask. It's not political. It's not showing that you live in fear or anything like that. It's just the smart thing to do, especially in this area, because we just passed like people selling barbecue in a parking lot, and none of them are wearing masks. Oh, it's crazy because like we just can't. How many people were out from just now? Like it was insane. I almost got like 2 accidents. There's just so many people out. And number-wise, we are at the same amount of cases that we had when the roads were empty and everybody was on lockdown.
I can't believe
It's just nuts.
we have to swab ourselves.
Oh look, there's LabCorp coming to pick up. Oh, I wonder if we just missed the cutoff. Maybe, I don't know. So they're either picking up. They're probably just picking up. They probably are the ones that would call you with your results, right? They're not going to bring the results back to the CVS and then.
Right.
So.
Or they're dropping off more supplies. I don't know.
Possibly.
They're probably out of supplies.
I know one thing. This line hasn't moved. I hope so. You think they're out of supplies? I hope so.
I don't hope so. I want to get this done and over with.
Want to practice?
Can't see him. He's behind that pole.
Well, he'll walk back to the car.
Yeah.
So the LabCorp guy, guess what? Doesn't have a mask on.
Come on, guys. Come on, out from behind that pole. Oh, there he is. No mask.
No mask.
Wow.
Come on, people.
His gloves on.
Insight into how all this is done. Homeboy in some Nikes has just got some igloo coolers in the back of his Chevy Traverse. This seems entirely on the up and up.
Wow.
How many vlogs out there you think are capturing this behind the scenes? Don't forget to like this video, please. And subscribe. We're close to 100 subscribers.
The bottom one is for Ashley, and then the top one is for you. I'm sorry, because the paper's kind of spilled out.
Top one is for me.
Yeah, the top one's for you, and the other one's for Ashley.
Okay.
So you guys reach into the bag. If you pull out you go ahead and pull out all 3 papers, or all 3 baggies.
Okay.
Then you're going to want to get out the bag that has the Q-tip and the testing vials. Go ahead and get those out the bag.
Okay.
And go ahead and open up the Q-tip baggie. Push it up from the bottom, and then you kind of pop out from the top. video so they should see it, but they're doing it right.
All right. There you
And
go.
stick it face down into the vial. Perfect. And then pop the cap back on. You guys are so insane. Alright, and then the next step is there's an orange baggie. Or you're going to actually want to unseal the bag. You don't want it in the part with the paper, so
Okay.
actually like open it
Right.
and drop it in there. Seal it back up. Alrighty, and so this next part is for you. You got to take Ashley's test because we're going to put them in the mailbox over here to your class. There
Okay.
should be a wipey. You want to use that wipey as like a glove, so you don't want your bare hands to touch the mailbox. So use the wipey, pinch it up, place the test in there.
Is it open? Is it? Oh, like a glove. Just drop them in.
I hope I went far enough. My eyes were watering.
My eyes are watering. I sneezed.
Like, it burned and stuff, but
Oh, it burns right now.
yeah.
My nose is around too. I need to blow it. What do you
Here are
like?
tissues.
All right. So, to be honest, it really wasn't as bad as kind of what I thought.
I mean, I went as
It was
far
just
as
a
I
normal.
could.
It was just a normal Q-tip too. I always saw people. I can't remember. I heard people saying they were like really long and stuff, and you had to
Yeah.
When she said only an inch, I'm like, oh, that's not so bad. And then I started going just a little bit, and I'm like, oh, I can start to feel the burn.
Well, then she's like, farther,
Farther?
farther.
All right. So she said, well, I'm like red. It would take about 2 to 4 days, and we'll be in our MyChart account. So that's kind of convenient, I guess. It'll just show up in there. I have to keep checking it. But all in all, it wasn't a bad process. What do you think? Thoughts? I mean, it's not comfortable, but it's not like, I don't think you're going to be afraid of it.
It wasn't terrible. Honestly, the flu test was worse, but the flu test is not a Q-tip. It's like a skinny little, like, pointy thing that they do at the doctor's office. That was just a legit Q-tip. I
Yeah.
mean, they were...
I don't know if you saw, yeah, you probably see it. I was trying to be, were you like in the camera? I was trying to,
I don't know.
Sorry, I'm not picking my nose. This is like really sensitive right now. I'm touching
They
it.
were legit normal Q-tips, like, that we just put in our nose. So,
Nothing crazy about them.
like, I could do it again. I hope I got it in far enough. That's about as far as I went. And
She did. I mean, she was looking. I saw her like she leaned over to see you clearer, to say if you need to go further. So,
I don't know.
did you feel that burn? Like that? I think you're good, man.
Yeah. My eyes were watering.
Yeah.
It burned,
So, like, I don't know. People kept saying like, "Oh my gosh, I heard that's terrible." I don't know if I'd say it was terrible.
No.
It was uncomfortable.
Right.
Don't get me wrong. But if one of the reasons you're not going and getting tested is because you're afraid of that test, I don't think that's necessarily a reason. Not to
The
go
flu
do it.
test that I got in February was worse, honestly. But I was also like really, really sick when I got my flu test, and I don't think that helps.
Yeah.
Because you're like sick and feverish and you can't breathe, and you're just like, and then someone comes and shoves something up your nose.
So there you have it. 2 to 4 days. I guess if we're positive, we'll post another video. If you don't hear from us, then we tested negative. But yeah. So in summary, finding a place could have been easier. The kind of the confusingness of doctor's offices not giving referrals, just telling you to go, places requiring referrals and appointments, websites not necessarily working or conveying enough information. It's kind of tricky. It could definitely, the system of getting a test could be easier. I don't know, you kind of saw, what do you think we waited? Maybe about 30 minutes, I would say. We got there about 2:10. My appointment was at 2:30. By the time we got up into the line, Ashley's appointment was at 2:50. It was about 2:51. So it took a little bit. So yeah, so definitely some flaws in the system. It could definitely be easier to get testing, but we figured it out. We got it done. Any thoughts? The whole process.
No, it wasn't that bad.
There you go. Wasn't that bad. And we're in a high, like I said, we're in a high volume area. I don't know if there's a lot of people trying to get tested done, so it may be easier in your area to go get one done same day. But and we heard people texting us and telling us if you go to a drive-through and tell them you're a healthcare worker, you can get it done right there, no appointment or anything. I mean, we weren't really about to lie just to get it done, but so yeah, I don't know. There you go. If you are around somebody who has been tested positive, go get tested. There's really no reason. It was free at CVS, not to pay anything. Wear your mask. Let's do what you can, and let's kick this thing in the butt for sure. So. Thank you guys. Like and subscribe to this video if it helped you out or if it answered any questions. We are at about 730 subscribers, so we're getting up there, getting close to that 1,000 mark, which would be awesome. But thank you guys, and hopefully we will be out of isolation soon and can enjoy some summer fun. So see you next time.